Alright, welcome back again. So let's continue where that patient was stroking, right? So I called the LPN guy to come and help me. So while this LPN guy was helping me, showing me how to send a patient out, my DON of this institution, there's name to them, but just consider them DON in a real sector. So that DON will show up to work. She showed up to work, the guy is showing me, and then she said, "What are you doing? Please remember this our DON only talk to, I'm just gonna call it the way it is. She mostly talk to African American. She does not fuck with African like that, except you are kissing her ass and doing what she wants. That's how it is. Otherwise, she fuck with African American, period. So this, she came, the guy is showing me, and she said, "What are you doing?" This lady face is always so angry. "What are you doing?" I said, "I'm sending a patient out." "Why?" "Because the patient is showing signs of this, and this." And the doctor said, "Send the patient out." She said, "Hold on." So I hold on. She went to the room, she came back to me and said, "That patient just called his name to me and told me he's from Cleveland. Pause that shit." I said, "Okay, there we go again with the ghetto English." So I paused the shit. She said, "Call the doctor back." I called the doctor back. When I called the doctor, this doctor is Indian, I believe. He's an Indian doctor. When I called the doctor and said, my DON said I should pause that shit, that the patient shouldn't go to the hospital, that Indian doctor said, "Who's the nurse?" I said, "Me." He said, "Who did the assessment?" I said, "Me." He said, "If what you told me is true and you are my eyes of that patient, then I'm not going to listen to your DON. You go ahead and send the patient out to the hospital." At this point, my DON is blue. She's mad. So she went, the Pixis is in a room. She went to that Pixis. This LPN guy and myself again will start the process of sending the patient out. So we started the process. This guy is showing me. Please remember, right now it's around almost 7 a.m. Day shift is coming in. Night shift is finishing that chatting. The nurse's station is packed. So she comes back from that Pixis room and said, "Do you want me to retrain you? Because you don't know shit." How was that? Okay. Guy, please. Every job you work, from what I know, I never work in Africa. Every job I have worked is in America. My experience is solely America. If your bosses think you are lacking in some areas, I have never seen them talk to you nasty among other staff. Usually they will call you in the office and tell you where you're lacking and ask you if you need training. And if you don't pick up, then they fire you. That's what I know. But this my DON, because she's unprofessional, when stupid meet ghetto, that combination is very terrible. Those two combination is very bad. So she decided she's gonna say it like that. So when she said that, I turned to her and said, "Do you know everybody learn differently?" So she said, in her words, she said, "I'll be retrained." So I was like, okay, whatever. So patient went out to the hospital. I came home. When I got home, the scheduler texted me and said, "DON said we should retrain you for 2 weeks." So I texted her back and told her, "You and that DON can have that job. I'm not coming back to that job." So when I said this, my husband said, "You know why? Hold on a minute. I'm not sure what's going on. You told me that you think a patient was having a stroke, and she's thinking that the patient was not having a stroke. So if I were you, what I would do is I would go back to that institution, be trained, but in the process of getting trained, see what kind of diagnosis the patient returned back to the institution with." I was like, okay, good idea. So I went back to be trained. But in the words of that my DON, she said, either her would train me or a supervisor will train me. But on this day that I will go to be trained, the person who was training me is the DON, one of her friends. This friend and myself will be hired around the same time. So when I saw her saying, I'm here to train you, I told her, no, you are not here to train me, because that DON will train me or supervisor will train me. I'm tired of all these nurses training me and I'm not learning anything. So when I said that, she said, if you like, you can call this number and ask who's training you. Please remember, these people have that click. The scheduler, this other lady that will be training me now, the DON, the African American, and the few African that kiss their asses, they are all cliques. They are all friends, like that, right? So when I called the scheduler saying what is going on, that she's trying to train me, this scheduler went, you are doing too much. She said, you are doing too much. And then she's yelling at me. So while she's yelling at me, I hung the phone off. When I hung the phone off, she called back. She called back. She said, give that phone to her right now. They called an HRT. So I took the phone. When I took the phone, she said, will you ever hang the phone off on your mother? So I was like, don't you ever refer to my mom in any conversation you and I having. So she and I went back and forth a little bit. So at this point again, I took my bag. I said, you know what? I'm leaving. But while I said I was leaving, this Sierra Leonean guy, he's the older Sierra Leonean guy. That's how he called me. He said, my daughter come. He said, do not leave. He said, time will come in this prison. You will talk whatever you want to talk and nothing will happen to you. So that foolishness they are doing of this one, that one, do that training. I went back to train. Please remember this, my trainer will be up there for the first 3 hours, like on my back, do this, do that, do the other one. But after the 3 hours, though, to be fair to her, after the 3 hours, she will come down and tell me, I'm going to that scheduler office. You are on your own. Do whatever you want to do. And then if you need anything, you call me. Let's stop here.